Thank you very much indeed for joining us today. People not being able to get a GP's appointment is something that people talk about an awful lot. Why do you think satisfaction is so low with the NHS?
Well, when I was resigned as a health minister in 2007, public satisfaction with the NHS was then nearly 75%. And the main reason for that was that people had access to the whole range of services. Dentistry was still a bit poor, but GP access was very good. GP A&E access was very good. And what we've seen is a failure of really to get the NHS in shape to deal with the increasing demand that comes with an aging population. And we have actually worshipped at the shrine of the acute hospital and poured money into acute hospitals rather than into GPs, community services, and much more significantly, prevention. Because prevention is really the missing which is the large elephant in the room, the lack of prevention to stop disease happening in our population.
It's interesting because you're talking about the ageing population. There has been a lot more money, over 40 billion extra pounds, that have gone in from 2010 when the Conservatives took power in the coalition. Clearly this is not just about money, Norman.
Oh, it's certainly not about money. But you don't increase productivity and efficiency if you do so much of your work in the most expensive part of the system, which is the acute hospitals. That's why, who have huge overheads, huge maintenance costs, and are not, in all cases, in too great shape. What we were trying to do during the end of the Blair government was move more of the work outside hospitals into community-based services, call them polyclinics, call them what you like. But much more of that work, the diagnosis and a lot of the treatment, could be done outside expensive acute hospitals.
Surely that was a lot of the...
failed to deliver that.
Sorry to interrupt you. Surely the argument would have been that a lot of that moving it into the community and reform within the Lansley reforms in around 2012, that the role of primary care, GP surgeries essentially, and polyclinics, for example, was actually brought to be much more important. Did those reforms just not work?
They simply haven't happened. And what we've seen is that a massive decline in the GP population. We haven't actually got a replacement rate for GPs that matches the numbers leaving. And what we're doing is training more doctors to go to Australia, as far as I can see. So we've got a lot of serious problems. And you wouldn't put more money into an NHS that's in its state now without asking some pretty fundamental questions about how it's organised, how it's delivering, its productivity, its efficiency. And the people at the top are not asking those questions in a rigorous enough state. It's not just the politicians, it's actually the managers at the top of the department.
You're a former, well, you are a Labour politician, of course, but you're a former Labour minister. You've earned the right to give your views on the next generation. Wes Streeting will probably be the next Health Secretary of this country. What do you think of his vision? He says the NHS is a service, not a shrine, and that major reform is needed. Do you think it's possible to get that reform? Because it seems to me that every time there's an attempt at reform, it's resisted by the system that often doesn't want change.
Well, it was certainly resisted to some extent when I was in the Blair government. I'm not a Labour member now. I sit on the crossbenches in the House of Lords. I think Wes Streeting is actually asking the right questions. The question, as you rightly put it, is can he deliver this? And it's going to require getting on with the NHS unions a lot better than this government has got on with the NHS unions. At the end of the day, you can only run a decent health service with a large degree of cooperation from the medical profession and the nursing profession. And that kind of relationship seems to have broken down, where we see these rather misnamed junior doctors still on strike activity and with a lot of support for strike activity. So any new government is going to have to do some hearts and minds stuff pretty quickly and be very, very clear with the NHS. My experience has been, unless you are clear with the NHS, you are going to make change and you carry on making change whatever the criticism, we will simply go back to this high dependence, excessively high dependence on acute hospitals.
It's interesting you mentioned the aspect of being clear with the unions and having to bring the unions with you, but some would argue that perhaps they're too strong in the number of junior doctor strikes that we've had. Tony Blair talked in terms of public service reform more generally of having the scars on his back. Will Keir Starmer and Wes Streeting have those scars too by the end of the first 5 years of a Labour administration, do you think, Norman?
Well, I hope they do have some scars on their back, because it will actually show that they're trying to actually produce change. What the public should have to accept is that change means they will get their services in a different way. The old model of the GP handling everything is going to have to change, because we simply haven't got the GPs to run things the way things used to be.
Okay.
And Wes Streeting is right. We're going to have to modernise primary care very, very substantially. And it's going to mean hospitals won't be as close to people as they used to be. The district general hospital model is broken, and we're going to have to change our approach. And particularly, we're going to have to work with the private sector if we want to give people more access to elective surgery.
Thank you.
The private sector have got capacity, and we've got to buy it.
Okay. Norman, thank you very much indeed. That's Norman Warner, Lord Warner, who is a former Labour Health Minister who now sits as a crossbencher in the House of Lords. Thank you to him for that. Lots of people getting in touch with the NHS, including Brendan in Hartlepool. Brendan, thanks for the call. 0344 499 1000 is the number he has called. Go ahead, Brendan.
Good morning. Good afternoon.
Hiya.
I totally disagree with your previous contributor.
Okay.
He said the NHS is struggling because we've got an ageing population. That's absolute rubbish. We in Hartlepool, we used to have a general hospital. It was closed and it was moved to Teesside. And there's various people were saying, apparently you need a 200,000 population to support a general hospital. That's the ratio.
Okay.
One general hospital. Last year, 600,000 people came to Britain net. Did we build 3 new general hospitals?
There's more than that, 745,000.
Whatever it is.
But a lot of people anyway.
That's why the NHS is struggling, because we are letting huge amounts of people in and we can't give them the medical cover. It's got nothing to do. The NHS is working. We are getting older and living longer because it's doing a job.
But surely when you get older, I mean, that does put a strain because so many people get dementia, for example.
No, I appreciate that, but the fact is that we're living longer, so the NHS must be doing something right. What it's not doing, well, the governments aren't doing, they aren't increasing the capacity, but they're letting everybody come in.
But
700,000 is 3 new hospitals.
You're absolutely right, Brendan. But what's also a point, a sort of a side point, is that many people who are coming to this country are coming to work in the NHS and to support that service even as it exists at the moment. Look around any NHS hospital, you see loads of migrants.
That's what everybody says. We don't.
It's true, though.
Sorry, it's of the 750,000 net last year. How many do you think came to work in the NHS?
Well, I don't know, but what I do know is that any NHS.
I bet you it's not more than 20%.
I don't know, Brandon, but what I do know is that any NHS, anywhere in the NHS that I go, I see lots of people who are migrants from other countries as doctors and nurses. That's just a fact.
No, that's right. And so the other side of that is, why should we be taking the people of the Philippines trained to be doctors and nurses? Why should they come over here? The Philippines will need them.
I'm very happy to have them here, but it's not very.
I appreciate that, but it's not very good on the Philippines.
Well, it's not very good for the Philippines. You make a fair point there, Brendan. Thanks very much indeed. Really appreciate that. I mean, Alicia Fitzgerald is still with me, who is political correspondent of TalkTV. Alicia, Labour has a massive problem on its hands in terms of the NHS. It's interesting, someone I know quite well who was formerly quite senior in the NHS, who just said there's a crisis every week. It's just, what's the crisis this week in terms of even in normal times? So given that it's under such strain and we've seen that only 1 in 4 people think the NHS is actually working, this is not a good basis for Labour going into a period of governance, because we've had, if we think about it, previously in 97, you had quite a good economy. Labour inherited quite a good economy and not a terrible NHS, but actually they will inherit almost certainly in November real problems.
Definitely, and you've really seen a shift in their public narrative about the way that they talk about the NHS too over the past year or so. I mean, a year or two ago, they were very positive about the NHS, whilst the government was saying, we've had COVID, we accept that we've had really difficult times, the NHS is struggling, and there's been even potential talks about privatisation, which is something that obviously the government always try and quiet, but it's something that is discussed. Labour
and they're using a lot of private resources, private hospital resources within this.
And Labour, during those conversations, were always very quick to say, no, our NHS is really, really important. We're so proud of it. It's amazing. We're going to do our best to keep it going and make it good. But what we've seen is a massive shift in that narrative. Wes Streeting, especially Shadow Health Secretary, coming forward and being a bit more frank and brutal about it, and actually saying, I think you quoted it earlier, that it's not a shrine, and that it isn't this massive, be-all and end-all amazing thing that's working really well, and that actually we do to be real and do something with it.
But as any GP will tell Wes Streeting, it's one thing diagnosing the problem, it's another thing treating it.